7th.
This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Thank you for tuning into this morning's Ministry of Health virtual media conference. Remember, these live conferences are your most accurate and reliable source of information on the ministry's COVID-19 initiatives. Today's updates will be presented by Dr. Miriam Richards, Principal Medical Officer, Institutions, Dr. Rohit Doon, Advisor Health Promotion and Communications and Public Health, and Ms. Keisha Pravat Gomez, Infection Control Nurse with the North Central Regional Health Authority. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. Dr. Richards will now advise on clinical matters as it relates to COVID-19 in Trinidad and Tobago.
Good morning, Ms. Alcantara, Dr. Doon, Nurse Pravat Gomez, members of the media, our listening and viewing populations. As I start the clinical summary with some of our statistics as of 4 p.m. on the 27th of October 2020, I would like to express sincere thanks and appreciation to all the healthcare workers and essential workers who have assisted in the national response to COVID-19. I would also like to recognize other stakeholders from other ministries such as the Ministry of National Security and the Ministry of Foreign and CARICOM Affairs. In this regard, the Trinidad and Tobago Defense Force, Trinidad and Tobago Police Service, Immigration, Customs, Civil Aviation Authority, Airports Authority, and of course not to be remiss, members of the Diplomatic Corps and OSH HSC managers and company physicians attached to upstream and downstream industries. Without the integral support of all of these stakeholders, our national COVID-19 response would be quite remiss, and so we thought it necessary to identify and thank them. As I indicated earlier, I would like to provide an update as of 4 p.m. on the 27th of October 2020. The total number of persons tested to date is 32,530. We have picked up 33 new positive cases which were reported in the last 24 hours. We have 4,186 recovered patients, 1,276 active positive cases who are under the care of the parallel healthcare system, either at one of the hospitals or step-down facilities or undergoing self-isolation in their homes. Thus far, as of March 12, 2020 to present, we have 5,568 cases. At present, we have 62 patients in hospital, 32 patients who are positive in step-down facilities, and 113 patients or persons who are repatriated nationals in state quarantine facilities. It is essential to note that we are looking at the ICU and HDU capacities at our hospitals as a measure of the resilience of the parallel healthcare system. Accordingly, the ICU capacity, which is cumulative between the Couva Medical and Multi-Training Facility, the Arima General Hospital, and the Augustus Long Hospital, is currently at 11%. Our HDU, or high dependency unit capacity, is currently at 23%. Accordingly, we have significant room in both of these categories of care, which should assist us in managing COVID-19. The overall capacity of the parallel healthcare system, which comprises 19%, is currently at 15%. And when disaggregated, the majority of those cases fall under the state quarantine facilities, which contain repatriated well nationals. It is essential to note that at this point, we have 3 repatriation flights scheduled over the next 6 days. On Thursday, 29th of October, we have a repatriation flight from Miami to Port of Spain with a maximum of 110 persons. These persons will undergo state-supervised quarantine for a period of 7 days and then home quarantine once they are well and have negative PCR tests on day 2 and so on. Additionally, we have another repatriation flight on Saturday, 31st of October from New York City to Port of Spain. This flight will also have persons who will undergo state-supervised quarantine followed by home quarantine. Lastly, we have a repatriation flight scheduled for Tuesday, 3rd of November from Barbados to Trinidad and Tobago. In addition to these, we have persons who are coming in on their own mode of transport, which accounts to about 75 or 80 persons within the next week. As I close, I would like to speak about the number of deaths that have occurred as a result of the COVID-19 pandemic in Trinidad and Tobago. At present, and as of 4 p.m. yesterday, we had 106 deaths. It is important to note that our last death, which was reported between the last media conference and this morning, occurred in a person who was under 25 years of age. While this was an exceptional situation and circumstance, and the person had pre-existing medical conditions, this is a warning sign to our population that COVID-19 strikes all persons. I would like to express condolences to the family of this patient and our sympathies to them. In closing, I would like to summarize the COVID-19 prevention measures that we must take to keep our population, our families, and ourselves safe. I would like to emphasize on personal responsibility. Please wear your masks and wear them properly. Ensure that there is social distancing in circumstances or situations that there must be a congregation of persons. Let us avoid parties and get-togethers at this point in time. Remember, even if you are healthy and you think you do not have pre-existing medical conditions, you will be exposed and expose your close family members and friends who may have coexisting medical conditions such as diabetes, hypertension, and other lung disorders. Lastly, I would encourage persons to continue hand washing and sanitization within their homes and the workplace. Together, we can defeat this COVID-19 pandemic in Trinidad and Tobago. Let's all work together to reduce the spread of this disease and keep our population healthy. Thank you very much.
Thank you very much, Dr. Richards, for those words of encouragement and for reminding us that COVID-19 affects everyone. Today, we will actually focus on one of the groups that are at highest risk, the elderly. And we go now to Nurse Pravat Gomez. She will present on infection control techniques that you may put in place at home, especially to protect your elderly loved ones. We go to Nurse Pravat Gomez.
Good morning, everyone. Doctors, members of the media, and the viewing public. I would like to discuss today certain measures that we can take to protect persons, elderly persons, as well as susceptible persons in the home. Elderly persons, as we know, would suffer with diseases such as heart conditions, diabetes, hypertension, and they are more susceptible to severe symptoms of COVID-19. As such, in order to protect them, we must first reduce and minimize them being exposed to the virus in the first place. Persons who have to leave the home on a daily basis to either go to work, such as healthcare workers, factory workers, food service workers, anybody who is leaving the home on a regular basis, on the return home must first remove shoes before entering the home. They should practice hand hygiene, such as hand washing with soap and water for a minimum of 20 seconds. They should sanitize surfaces that they would have touched, such as the doorknobs, such as the light switches, and continue sanitizing surfaces in the home, such as the table, the countertops, the bathrooms, the faucets. These are things that you can do in the home. Also, if you have susceptible persons living in the home, it is important that you wear your mask when social distancing cannot be maintained. And this is for even in the home. It is also important for individuals to monitor their health. So monitor for flu-like symptoms. If you have any fever, anything like that, monitor these things at home, because even persons who do not exhibit symptoms can spread the virus. It is important for persons to talk to younger children in the home. Let them know that if they are not feeling well, to let them be able to voice. Let them not be afraid to say that they are not feeling well. And that way, measures can be put in place to protect the elderly and the more susceptible at home from contracting any type of disease. It is also important that individuals, everyone in the home, should be vaccinated against the flu. The flu vaccine cannot protect you against COVID-19, but it will protect against the regular flu. It is also important to note that if you have elderly persons at home, they should not be the one exiting the home to run regular errands. These errands, such as going to the groceries, going to the market, should be done by persons who are at lower risk, right? Also, remember to sanitize your hands before putting on your mask and after removing your mask. I know that persons like to visit, but it is important to remember that we are in a pandemic, so social visits in the home, even with family members, should be limited or discontinued at this point in time. These are some of the measures that we can put in place to protect our elderly persons in the home from contracting the virus.
Thank you very much, Nurse Pravat Gomez. And a very important point raised there. Even other family members may put your elderly loved ones at risk if they're not part of the same household. So we really, really want to discourage family gatherings of persons that are not within your home bubble. Create a nice, safe bubble for yourself and your family, especially if you have an older uncle or granny or grandpa that live with you. Please take extra efforts to protect them. And our last presenter this morning is Dr. Doon. He will present on the topic of COVID-19 as it relates to the elderly, especially those that are in institutions. Dr. Doon.
A pleasant morning to all. The elderly persons, as we all know, are particularly susceptible to COVID.
Yeah, and I think we just want to get Dr. Doon to put on his mic so we can hear his info. Thank you.
Yes, elderly persons, as we all know, are particularly vulnerable to COVID-19 because of advancing age. They may have pre-existing conditions, as we commonly call comorbid conditions. You've heard about them: diabetes, heart disease, hypertension, obesity, cancers, etc. And they're also going to be living in a close living arrangements, which makes it another factor there that one can easily, if you get an infection, you spread it. So the ministry has a special responsibility for these type of agencies, these long-term care facilities, because you see they are registered under our Private Hospital Act, and they must be registered and certified as meeting all the requirements. So these facilities are routinely inspected and monitored by the county medical officers of health in the country and their respective health teams, so that we are assisting and supporting these facilities in infection prevention and control. During the interim, the ministry has produced a specific guideline for these special facilities, the long-term facilities, deals with infection prevention and control in these facilities. And its specific goals are: one, to prevent illness in the residents and the caregivers, because more often than not the infection will be transported into the facility by the caregivers or the other folks that work there and the operators. And the secondary goal, and importantly, is to prevent an outbreak in any facility, therefore transmission from one person to another. And the guidelines that we have produced will go into all the details of how the householder, not householder, mind you, the operator of the facility and the caregivers will manage their work process in terms of personal hygiene, masking up, environmental hygiene, and distancing within the facility, and rotation of group activity within the facility by residents. So you have small numbers in group activity and separation when they're having lunch and coffee breaks and tea breaks, etc. So all that is laid out there, and environmental hygiene, the surfaces of the facilities to be kept in a particular way, and the environment to be clean, particularly in managing waste and managing soiled laundry. All those laid out there. And the third approach is the training component of the workers and the caregivers. And to this end, we have prepared these guidelines, the IPC guidelines for use by the facility operator. Now, I must say that in this regard, we rely quite a bit and are partnering with the association, the Long-Term Residential Care Association, and they have been well trained and will, in any event, they are continuing the messaging and training their workers, and the ministry will provide the support in monitoring and evaluation of the activities in the facility. So that this approach, as you see, requires the cooperation between the provider, the operator, the association, the Ministry of Health, and the county medical officers of health, who are at closest in the area where these people operate, these agencies. Now, it is very important to note that so far we have not reported any cases of COVID-19 in any of these facilities, of which there are more than 200, and but the population in these facilities would exceed about 3,000 folks. Elderly folks do have, as I mentioned before, comorbid conditions which make them very susceptible to severe COVID infections and the severe complications of COVID and the risk of dying from the disease. And more often than not, those of the members of the population that would have died would have had comorbid conditions, and they would have been elderly in any event. So 60% of all those that died so far are over 60 years of age, 67% over 60 years of age, and the comorbid conditions also very prevalent now. The prevalence of comorbid conditions in COVID patients so far in this country is about 68%, accounted by diabetes, hypertension, and heart disease. Given the prevalence of these chronic conditions in the general society, as we know, more than 62% of all deaths in this country are attributable to these chronic diseases: cardiovascular disease, cancer, diabetes, and more importantly, the risk factors which go along with them: unhealthy diets, alcohol, smoking, and inactivity, and central obesity. Now, by central obesity, which is a very significant risk factor, I'm not referring to obesity in Caroni and Chaguanas. I'm talking about obesity around the abdomen. That's what we mean by central obesity. So, we do have these factors in the general prevalent, most prevalent in the general population. About 55% in the general population in this country are either overweight or obese, which is a significant risk factor both for hypertension, cancer, and diabetes. Now, COVID-19, and in addition to all these chronic conditions, is really a very toxic mixture. And so that in dealing with COVID-19, we must always be aware you cannot separate it from these comorbid conditions. We've got to manage both simultaneously. It's very important to do that. So we do have a chronic disease, or NCD as we refer to them, non-communicable disease epidemic in this country. And particularly the behavioral risk factors of diet, smoking, and not enough exercise, and the biological risk factors of obesity, hypertension, and diabetes. So far, we have estimated, I will deal a little bit with hypertension in Trinidad and Tobago. It is estimated in this country that we have the prevalence of hypertension in this country is 30% of all adults, which make it just over 300,000 persons in this country who we estimate to have hypertension. A stark reality is that 30% of the population don't know that they even have diabetes. And of the number that are being treated, only about 30 to 50% are being controlled effectively by the drugs. So in other words, what I'm saying here, you've got to know your numbers, folks. We've got to measure. If you don't measure, you wouldn't know. If you ever get your blood pressure measured, you'll never, you'll be walking around with a silent trouble appearing on your doorstep suddenly. We don't want that. So I would urge you to get your blood pressure checks. One year over 40 years of age, get it checked. It is a matter of life and death. The other issue about hypertension is that is the single most important risk factor for developing cardiovascular disease conditions. Single most important. That is very important to understand the relationship between hypertension and cardiovascular disease and the complications. For example, long-term end-stage kidney disease. Now, we have introduced in this country, late last year, an evidence-based treatment protocol for hypertension. And this protocol speaks to the use of 2 medications used every day as a single dose, 2 separate medications to control high blood pressure. And globally, this has found to be best practice. It is useful to note that when you use those 2 drugs, single dose per day, once a day, you will be able to control your high blood pressure efficiently and effectively, so that with good control of high blood pressure, you will be able to reduce mortality, morbidity, and disability from cardiovascular disease by as much as 50%. So this is very good news. As it is very simple to test high blood pressure. You go to your health center, go to your doctor, or you invest in a home device to test your pressure. You get to your physician or the clinic, which we have throughout the country, almost 99 health centers. You go there, you get your blood pressure checked. Measurement, I want to reinforce, measurement is the key to successful control. You will only know if the tablet's working, you're taking it correctly, if you measure your blood, get it measured. And once it's under control, that's fine, it's easy to control. So self-management is an effective strategy that we wish every adult in this country to engage themselves in, knowing their numbers, particularly their weight, their cholesterol, their blood pressure, their blood sugar, and these are the numbers which are very useful to help you live a healthy, happy life. So self-managers is awfully important. And in summary and in closing, I'd like to say for you that COVID-19 and the NCDs like cardiovascular disease, diabetes, etc., and cancer are inextricably linked in the elderly. So we must address both simultaneously and focus on healthy living, healthy habits, healthy behaviors, and knowing your numbers and get checked regularly. Thank you very much.
Thank you very much, Dr. Doon, for making that very clear and very necessary correlation between NCDs, non-communicable diseases such as hypertension and diabetes or high blood pressure and high blood sugar, with the morbidity and mortality that we are seeing with COVID-19. And we now invite media representatives to direct their questions to members of the panel as we begin the question and answer segment. Please state your name and your media house before you ask your questions. And since our time is limited, we want to give everyone a fair opportunity, please. Thus, a maximum of 2 questions from each media house in the first instance, and if time allows, we'll accommodate additional questions. Our panelists are ready, and we begin with CNC3 of Guardian Media Limited, please.
Hi, morning everyone. Rashad Khan, Guardian Media. My first question is to Dr. Richards. So you mentioned that the latest death was under 25 years old. Now, I understand the patient confidentiality aspect, but would you be able to say if this was the youngest COVID-19 death we've seen in the country? And if not, how old was the person that was the youngest death? And second question to Dr. Doon. So you ran through some of the statistics for people who have NCDs and the comorbidities for COVID-19. But are you in a position to say, let's say we lose control of the COVID-19 virus, and worst case scenario, everybody gets infected. With these figures, how many deaths would we be seeing locally? And taking into consideration the death rate of people who have NCDs that we're already seeing as well.
Thank you very much. And we go to Dr. Richards to respond to the first question.
Good morning, Rashad. Thank you very much for that question. So I will start by saying that we have to consider patient confidentiality practices by the Ministry of Health. This has been the youngest death from COVID-19. And while I am unable to give you the accurate age of the patient in the interest of patient confidentiality, I would like to remind the public that no age group is immune from the morbidity or illness, as well as the death or mortality from COVID-19. It is key to note that although this patient had pre-existing medical conditions, this was a very young patient in terms of their age group, as we said, under 25 years of age. And so this person would have passed away, I think, between about a day between our 2 media conferences. In closing, we again would like to express sincere condolences and our sympathies to the patient's family. Thank you.
Dr. Doon?
Yeah, could you repeat that question for me? I'm trying to figure out what you're getting at in terms of mortality that you're asking.
Yes, we can hear you, Mr. Khan. Please.
Okay,
please
all right, Dr. Doon.
Yeah.
Okay, so with the figures you've given us, right? So the amount of people with these comorbidities living within Trinidad and Tobago, right? And taking into consideration the rate at which these persons have shown to have died from the virus locally, if in a worst case scenario, every citizen catches COVID-19, we lose control of the situation, how many or how high could that death toll be? Hypothetically speaking, of course.
Well, I don't know. I mean, I know what the models say. I would guess what, about 5%? Less than 5%, between 2 to 3%, yeah. Yeah.
Yeah, okay, so
In other words, that's the excess mortality.
Okay.
Okay, great. Thank you very much, Dr. Doon. And we move now to AZP News.
Good morning. Hi, good morning. Priya Bihari, azpnews.com. I wanted to speak a little bit about non-contact sports. There's a case being made now if these non-contact sports can take place and once the protocols are observed, COVID-19 protocols are observed, and in one instance, the head coach of Barracuda, Mr. Christian Humer, went on social media and is asking if swimming could be one of those sports that can be allowed, in the same sense that the sport company is now allowing athletes to use the aquatic center. Once of course they get the permission of the Ministry of Health. So I just wanted to find out if non-contact sports, once they follow the protocols, the proper protocols of social distancing, and those issues can take place. And my second question quickly is that can Dr. Abdul Richards tell us what would pre-existing conditions of the person who died, who was under the age of 25? Thank you.
Thanks a lot, Priya, for your question, which is very topical in terms of non-contact sports. Please be advised that the decision to include or exclude non-contact sports falls under the remit of the Honorable Prime Minister and his advisory committee, which consists of the Chief Medical Officer and other physicians attached to the Ministry of Health, as well as the Honorable Minister of National Security. As per your question regarding the use of the pool facilities at SportTT, I would direct you to the Ministry of National Security, under which that state board falls under the purview of, for further information and clarification on that question. Your second question referred to pre-existing medical condition or conditions of the recently deceased patient. Unfortunately, due to confidentiality rules which we as physicians adhere to, we would be unable to give you that sort of detailed information. However, I would like to reiterate to members of the population that COVID-19 can affect each and every one of us, irregardless of our age and the presence of other medical conditions. Thank you.
Thank you very much. And we go now to 98.1 FM, please.
Again, good morning to you, Ms. Alcantara, and members of the panel. Stephen Cummings here, 98.1 FM. I have two quick questions, and those questions can be addressed by Dr. Richards. Dr. Richards, good morning to you. Seeing that, my first question, seeing that it is important to always have a robust, fortified healthcare system, can we say as of October 28th, today, that we are adequately and sufficiently staffed when it comes to having a fair cadre of specialists to carry both the traditional and parallel healthcare system, so as to provide a strong enough response not only to COVID-19 but in general, common public health threats that we come our way from time to time. The question comes in the view of this continuous, persistent call for strengthening of our public health systems. And the second question, Dr. Richards, the non-invasive cardiac lab at Mount Hope, someone called me saying after a year and since March, the onset of the COVID-19, they have not been able to get an appointment. Was told that only in-house patients were being responded to. The patient, I'm told, is in urgent need of constant event monitoring and testing. Is asking when are services or service appointments going to be resumed, if in fact they have been curtailed or stopped. Are you able to speak to whether or not there has been any disruption with reference to appointments? Thank you.
Thank you very much. So you spoke on two very interesting points, which really refer to the traditional healthcare system. So our health system and our health system response at this point in time falls under the traditional healthcare system, which are the regional health authorities and associated hospitals, for example, the Port of Spain General Hospital, the Sandy Grande General Hospital, the Eric Williams Medical Sciences Complex, the Point Fortin Hospital, and others. And your question really was centered around if we have a robust and fortified health sector response given the COVID-19 pandemic, as well as if we are adequately and sufficiently staffed with respect to consultants. With the COVID-19, I'll start with the parallel healthcare system. With the COVID-19 response, we have hired and recruited more than 100 physicians and about 60 nursing personnel, in addition to other categories of staff that are required, such as nursing assistants, for example, and ancillary staff, laboratory technicians, to support the clinical management of COVID-19. What I will indicate with you is that we are also engaged in negotiations and technical cooperation agreements with other countries to recruit specialists, for example, in the areas of pulmonology or chest medicine, intensive care, and so on, to really fortify and strengthen that approach. At present, we have been able to manage the parallel healthcare system with these specialists that we have, especially given our occupancy rates. However, this does not mean that we are not on the constant lookout for additional staff in order to strengthen and to make our system even more resilient in the event of a future wave of COVID-19. With regards to the traditional healthcare system, which really comprise the regional health authorities and primary healthcare centers under our purview in the Ministry of Health, there have been some changes with respect to the COVID-19 mitigation measures in clinics and elective surgeries. Now, for example, we would have a smaller number of persons in a per clinic at any given point in time due to social distancing. Our elective surgeries, which are non-urgent surgeries, really comprise less cases on a given day because the turnaround time and the need for personal protective equipment and preparatory testing for COVID-19 are in place. However, that does not mean that the actual numbers of persons or that persons do not receive care in terms of the facility. Your other question was centered around the non-invasive cardiac lab at the Eric Williams Medical Sciences Complex, which was reported to be non-functional for outpatient care since the onset of COVID-19. I would implore you and ask you to send us an email at the Ministry of Health via the Corporate Communications Unit, and we will provide an update to you within 24 hours on the status of that clinic, because we need to identify what exactly would be the root cause of the challenge at the cardiac lab at Eric Williams Medical Sciences Complex. Of course, given Dr. Doone's summary of the role of NCDs, the prevalence of non-communicable diseases such as hypertension and diabetes mellitus in our population, and the fact that these diseases contribute to severe illness and possibly death in patients with COVID-19, it is imperative that the Ministry of Health ensures that all supporting services for the management of these diseases are in place and fully functional. So in closing, what I would like to say is that at this point in time, we are making every effort to ensure a very robust and resilient healthcare system, not just for COVID-19, but for our traditional levels of care, which is under the RHE. Thank you very much.
Thank you very much, Dr. Richards. And we go to IETV now, please.
Hi, good morning, everyone. Binama here, some IETV News. I have one quick question for Dr. Richards. Dr. Richards, a viewer messaged us to find out, saying that school is closed, are teachers allowed to have private lessons at their home? Keeping into consideration the social distancing, is it okay for them to have private lessons at their homes, especially for special needs children and children prepping for exams? Thank you.
Thank you again for that question, which is very, the situation you described is extremely commonplace from what I've been told. The management of COVID-19 is centered around a reduction in commingling, which is the mixing of persons and the congregation of persons. Therefore, at the Ministry of Health and in line with World Health Organization guidelines, which are accepted by the majority of countries on the globe, we recommend that any sort of activity where persons congregate or commingle should be avoided. So, for example, it's not just, we don't just refer to lessons or classes for students, but also other activities such as parties and anything that can be avoided. We have to use digital methods. This is the way that we have been progressing. And as regards lesson students, we understand and appreciate the situation that parents may be in, given online schooling and the need for remedial teaching for students. But we would like to advocate that teachers employ digital methods such as Zoom classes and digital teaching in place of the usual or traditional lesson system, which rarely promotes commingling and congregation of persons and can increase the risk of transmission of COVID-19 to our students and by extension their parents, grandparents, and persons who are at high risk of basically suffering the complications of COVID-19. So thank you very much.
Thank you, IETV, for that question. We go to Newsday newspaper now, please.
Hi, good morning, everyone. Good morning to the panel. Can everyone hear me?
Absolutely.
Yes.
All right, great. First question I want to ask is a little bit off topic. There has been a few complaints and a few observations of certain police officers who have been operating in police vehicles in groups of four as they would usually be in, but not wearing their masks. Now, given that they have to enforce laws that basically tell people to wear masks while they're in cars, I don't know what kind of advice has the Ministry of Health been giving to the police service, and how has that advice been trickling down? That's my first question. And for my second question, there has been a little bit of confusion concerning horse racing enthusiasts, given the new rules that gambling institutions and members clubs could be opened at 50% capacity. Now, given the thinking that horse racing and gambling groups are also private members clubs, are they able to open at 50% capacity as well, especially in tracks and areas like that, which may be considered as sporting facilities?
So, good morning, Ryan. Two very interesting topics. Firstly, regarding the actions of the TTPS, especially when doing much needed patrols in this time of COVID-19. As I indicated at the start of my clinical summary, the Trinidad and Tobago Police Service has an extremely close relationship with the Ministry of Health, especially as per the national response to COVID-19. Given your observations, we would have a discussion, because we meet on a regular basis with the acting commissioner or commissioner once he returns, as well as the executive director of the TTPS and the assistant commissioner of police, who tends to assist us greatly with respect to the surveillance of persons who are in self-isolation. And we would provide a reminder to the TTPS via these officers of the need for wearing of masks while on patrol, as well as the maximum occupancy in these vehicles. So that is the response in terms of the first question, which really involves collaboration between the Ministry of Health and the TTPS at the Ministry of National Security, which is very easy because we have an ongoing relationship with them. The second question pertains to rules regarding horse racing enthusiasts, private members clubs, and gambling institutions. For this question, we would prefer to refer it to the legal department of the Ministry of Health and the Attorney General's office for a response. I myself am not a legal person or a lawyer, and in order to provide clear, transparent information to members of the public, we will refer this question to legal and possibly share via our corporate communication unit a clear response. So thank you very much.
Thank you very much, Dr. Richards. And as you know, we had begun to field questions from members of the public in some of these press conferences. And one of the questions that we received probably can be directed to Dr. Doon. One of the questions that we received was from someone who's over the age of 60, and they're in a household. They live with themselves, just the two of them, a couple. They're both over the age of 60. What should they be doing? One of them is hypertensive. What sort of measures should they be taking? They have to go outside to do their own grocery shopping and to do their own errands. What would you advise persons in this situation?
Well, there are two things at play here. One is the management and prevention of COVID infections, and then managing the hypertensive disease. The hypertensive disease is pretty simple. As I mentioned before, we have new protocols and ensure that you are being managed as per the new protocol. That is the fixed dose combinations once a day, referred to as fixed dose combination. So if you're not getting two medications to manage your hypertension at the moment, you talk to your physician or you go to the clinic and inquire as to why not and when we will start, because that's best practice globally. That's what the world is promoting throughout the health sector now. The other component about preventing getting infections, well, we have the same process and protocols apply, the mask, the hand hygiene, you stay away from crowds, you try to keep your 6 foot distance away from other folks. And those are the simple measures. Repetition is important. Don't the risk is when you forget to put on your mask at appropriate time, when you forget to wash up and clean up when you're getting back into the house from outside. So it's just taking cues that you have to maintain personal hygiene and distancing and protect yourself and take your medication. Reinforcement is the key, and adherence is the key. So repetition, really remember to repeat these simple fruits.
Thank you very much, Dr. Doon. And we go now to Express Newspaper for questions.
Good morning, Kim Bodram from the Express. Dr. Abdul Richards, you did mention earlier that the effort right now is to keep the commingling down. So we do understand that. But up to this morning, we are still seeing that the business chambers, the community is calling for, let's say, a tighter sort of consultation with the health experts so that they could move a little bit closer to opening. And I'm talking about the cinemas, the restaurants, specifically, and the bars. So we know what the health authorities are saying, but we know what the business community is saying, and that they're really on the brink of collapse. I want to ask, in the process of consultation, can you give us a bit about how that works? They seem to want closer consultation. Is there a medical team of experts that meets with, for instance, these business owners? A team where it's almost a one-on-one encounter per person, so that they could really get what they want out of it and convey not just their concerns, but they are saying, look, we have the protocol in place. If someone would listen to us and trust us, because the cycle is just going to go on. That's one. Thank you. Also, I hope I didn't miss this, but the repatriation committee, if there's an update on that, have they met? Has anything at all come out of that? Would you, Dr. Abdul Richards, have anything at all to say with regard specifically to repatriation today?
Thank you very much, Ms. Boudram. I think Dr. Richards is ready to respond. I think we get the gist of the questions.
Okay, Ms. Boudram, thank you very much for your questions. Your first question is one that has been really highlighted by members of the private sector, especially persons in the entertainment industry, regarding the restrictions that are in place. The Ministry of Health is cognizant of the impact of the restrictions on persons in the private sector with respect to employments and so, but it is important to note that any sort of decision regarding the implementation or the removal of restrictions falls under the purview of the Honorable Prime Minister and the committee that really advises him. So that final decision is one that the Honorable Prime Minister makes. In terms of a consultation process, the Ministry of Health has provided guidelines to employers regarding the conduct of business and COVID-19 prevention measures. We look forward to seeing a decrease in the number of COVID-19 cases based on the population's adherence to COVID-19 measures, so that we can advise and note if restrictions can be relaxed in the very near future. Secondly, your question pertains to the repatriation committee. The process for repatriation of nationals falls under the purview of the Honorable Minister of National Security and the Ministry of National Security. The Ministry of Health advises on the necessary quarantine arrangements upon consultation with the Honorable Minister of National Security. It is important to note that at this point in time, and as per the Prime Minister's directive, the Ministry of National Security has accelerated the granting of approval for exemptions and has partnered with CAL to have repatriation flights for returning nationals from places or countries where there are large requests in place. So, for example, as I indicated earlier, we have a maximum of 110 persons who are due to arrive tomorrow on Thursday, and they will undergo quarantine at a state-supervised facility, followed by home quarantine once they have no pre-existing medical conditions or are not tested positive. We have a second repatriation with returning nationals from New York City. Again, a similar number with a maximum of 110 on that flight. And then a third repatriation exercise next Tuesday the 3rd from Barbados. It is important to note that there are several factors that that we have to take into consideration when we organize a repatriation effort, and even issues regarding social distancing in the aircraft must be taken into consideration, which is why we have to have a cutoff limit. These measures are essential in keeping our returning nationals safe as well as our population, and we thank members of the population and nationals abroad as well as their relatives for their patience, support and collaboration during this process. Thank you.
Thank you, Dr. Richards. And I see we have a follow-up question from CNC3, please.
Hi, morning again. I just wanted to know, Dr. Richards, would you be able to give some guidance as to the wearing of masks at the gyms? Because when the gyms were closed, the guidelines were previously put out, mask wearing was not made mandatory. So if you could just weigh in on that.
Thank you, Rashad. I would like to indicate that the guidelines are on the Ministry of Health's website, and I would like to encourage members of the population to really read these guidelines and understand them. We have a hotline, 877-WELL, where persons can obtain clarification on these guidelines. And I would like to indicate that there's a need for guidelines or reading of guidelines, because mask wearing is just one of the areas to protect persons while at the gym. Additionally, we would like to really endorse or recommend that persons can wear face shields at the gym given the nature of their activity. So thank you very much.
Thank you very much. And ACP News, a follow-up question from you, please.
Hi, good morning again. Thank you for the follow-up question. Since we're on the question of masks, ACP News we have had a lot of questions about whether the masks with the filters and with the HEPA filter, are those acceptable? Just wanted to find out that. Thank you.
Thanks, Prior. With regards to mask wearing, the World Health Organization has guidelines on the levels of personal protective equipment, or PPE, for persons who are either employed or for members of the general public. At present, we do not recommend the use of the mask with the HEPA filter, simply because we can have pathogens and other airborne particles being introduced into that. For members of the population who are not employed in high-risk or moderate-risk occupations, we recommend the use of face masks. So thank you.
Thank you very much. And we have a follow-up question, or first question, my apologies, from Miss Cutting. We're ready now to go to Renisa Cutting, please, of TV6.
Hi, good morning. Good morning. I'm not sure whether I missed this because my reception is coming in and out, but could we have a figure for the number of persons who have been repatriated thus far? And also, I know that the Ministry of Health, you all keep reiterating that the situation is very fluid, and there's no specific number, threshold number, where a decision would be made as to further impose restrictions and these types of things. But it's just that we know that we have the virus and it will never go away, so to speak. So what we want to get a clearer understanding of is exactly what are the considerations, especially where it concerns the entertainment sector. What are the maybe specific things under consideration that would influence a change in the stance, considering that the Prime Minister did indicate that this would be reviewed in 2 weeks' time. So what could change or what has to change?
Okay, thank you very much, Ms. Cutting, for those two very interesting questions. Your first question centered around the number of persons who have been repatriated since the repatriation process was commenced. The repatriation process was commenced on March 23rd of this year, when our borders were closed to protect the safety of our population. The repatriation of nationals has been ongoing since that date. And even though now we are seeing mass repatriations from places or from cities such as Miami and New York City, the repatriation process has been ongoing with smaller numbers of persons who have been entering the country for various reasons from several different countries of origin or departure points. I would direct you to the Ministry of National Security for an accurate figure of the number of persons repatriated between, I would say roughly between the first repatriation, which was in July or so, somewhere around the July the 18th to present, which are the CAL arranged repatriations from high-risk countries. We are possibly somewhere in the region of 800 persons being repatriated. However, this number is quite an underestimation given that persons are being repatriated by other means, some by vessels. We also have persons who are coming in on chartered flights. So, in summary, we can liaise with the Ministry of National Security and the Honorable Minister of National Security to have a more accurate and transparent figure supplied to your media house via our corporate communications department. The second question that you referred to regarded the warning signs, or I should say trigger signs, that are used to either upscale restrictions or to relax restrictions. Again, I would like to indicate to members of the public and media that the decisions regarding the relaxation of restrictions or the tightening of restrictions falls under the purview of the Honorable Prime Minister upon consultation with several persons and even on the advice of other ministers. For further details on that question, our Honorable Minister of Health, Minister Diyal Singh, will be at Saturday's press conference. That would be on Saturday, the 31st of October, and he can really describe a more detailed and in-depth process, given that he is a member of that committee. Thank you.
Thank you very much. And we have come to the end of this morning's press conference. And we just want to remind you of some of the key points that came out this morning. Dr. Doon reminded us to know your numbers. Know your blood pressure, your blood sugar, your cholesterol numbers. Those are very important, especially for those who are over 60. We had Nurse Pravat Gomez, who spoke about the things that we can do to protect our elderly or those over 60 who live with us, who are in our homes. We have to take special care of them. And just a little idea, if we have a little girl, a little boy, if you're missing granny, do up a nice poster, tell mommy, let's do a drive-by and wave from a distance. So we find ways to keep socially connected while we are physically distant. Everyone be safe. Please remember to wear this over your nose and your mouth.
COVID-19 is here and has become everyone's business. It's not a respecter of age, race, gender, one's financial, educational status, or mental and physical ability. Therefore, it is our duty to prevent the spread of this virus in our communities. We all have a part to play with this pandemic. Therefore, there's so many things we can do. First of all, we can wear our mask, practice good hand hygiene, that is washing your hands and hand sanitizing, as well as maintaining the social distancing at least 6 feet apart. Added to that, you can eat well, rest well, hydrate well. Ensure that you maintain your immune boosters by taking multivitamins. We, the frontline healthcare workers, need you to help us with this fight. To those suffering with predisposed and health conditions like asthma, diabetes, hypertension, renal disease, autoimmune disease, just to name a few, take your medications as recommended by your health physician. Families, friends, I urge you to ensure that their supply is adequate. Do not let it finish. Also, take your recommended diet as per health condition. Do not cheat, for to cheat means you put your body in a difficulty to cope. To those persons living with depression, other health and mental health and emotional health conditions, self-quarantine is a difficult time. We know and understand this. I urge families and loved ones, do check up on them regularly. Send a voice note, make a phone call, extend your love, care and support to them as they do need your care and support at this time. To the youths of Trinidad and Tobago, do not think for 1 minute that you are exempted from this virus. I urge you to encourage good behavior amongst your peers. Do exercise good health practice and also ensure that you exercise the preventative health measures in this pandemic implemented for your benefit. I must add, in support of my health colleagues, we are committed to ensuring that you receive the delivery of care that is necessary to aid a speedy recovery for those who end up with this virus. Do act responsibly. Ensure that you maintain good health practices. Protect yourself and in so doing, protect your loved ones. For prevention is so much better than cure.